let's cut to the chase, people. Your dog doesn't need that French fry, that extra French fry that is doing grave damage to your dog. And if you're here, it's because you have a retriever or another large breed dog and they're limping around. Okay? Well, there is a very good possibility that just like you're overweight, and even if you're not, your dog is overweight. Weigh your dog. If your dog's having problems with limping with their hind legs, chances are they're overweight. And yes, it could be Lyme, it could be another genetic disposition, but whatever it is, it's compounded with the fact that your dog is overweight. So in the comments, reply with whether you thought your dog was a healthy weight and their actual weight, which chances are your dog is overweight. It's sad. Bacterial infections like Lyme, there's a bunch of them. Especially in, rural areas, you're going to see a lot of deer ticks. 1 in every 100 ticks, roughly, has the bacteria that causes Lyme disease. There's no real way to test for it. So you're going to bring your dog to the vet. The vet's going to want to do all these tests. And there's a lot of false positive and there's a lot of false negatives. So if you bring your dog and they do x-rays and it doesn't look like there's anything that's specifically wrong, and the vet's going to say, well, your dog has a genetic disposition to hip dysplasia, whatever it is, do give your dog a short test of doxycycline if there is a substantial improvement. And a dog, for instance, a Labrador, Golden Retriever, or any large dog, you give them, vets normally recommend 200 milligrams of doxycycline. Give them 400 to 600 milligrams for the first dose. It's called a bull dose. If within 24 hours you see any substantial improvement, then continue the doxycycline for 4 to 6 weeks. It's very important that you check their feces, their poop, and if there's any substantial change in the color, and you're giving them big doses of doxycycline, 400 milligrams per day, 500 milligrams, then reduce the amount of doxycycline so that you don't cause liver damage. But it's important that you give them a very large dose in the beginning, at least for the first couple days. An 80 to 100 pound Golden Retriever, Labrador, or any large breed should take, for the first couple days, 600 milligrams, 300 during the day, 300 at night. A vet isn't going to tell you this because vets don't want to be liable if your dog has liver failure. But in order to solve bacteria problems in dogs, and dogs don't process antibiotics as well as humans do, you're going to need to give them a very large dose. Whatever you see recommended by a vet, use twice as much for the first 24, 48 hours, and that knocks the bacteria out. And I'm not a vet, but I have helped many people with animals, specifically dogs, with antibiotics, making recommendations. Vets don't want to take a chance because they don't want to be sued, so they go the safe route. Double whatever the antibiotics is. Make sure that you check the feces, if it's changing substantial, if it's clay-like. If you take it and you put it in a toilet and it floats, then there's a problem. If it sinks and it's dark colored, not too dark because you need to make sure it doesn't have blood in it, but if it's just check before, check after. You want it to stay the same. If there's a slight change, then that's fine. But if there's any substantial change in color, then it could be a bad sign. If there's a huge change and if it's white or if it floats and it's clay color, then bring your dog to the vet and have them check for liver function. Or if it's just a slight change, or if there's any kind of real change, decrease the amount of antibiotic. But you want to have as much antibiotic that the dog can handle without having problems with their liver. So if you want to be super safe, have the vet take a blood sample every 7 to 10 days and check liver function, and just keep that antibiotic up. Give little baby aspirins every 2 or 3 days, because you want the blood to be thin, so that because bacteria likes to hide in extremities, it cuts circulation. When you give the dog antibiotic and they sleep, they're going to wake up, they're going to feel stiff because the bacteria restricts the blood flow. Just do research, Google. But the most important thing is your dog's overweight. It's limping because it's overweight. That's just 90% of the time, dogs are overweight. You want to spoil your dog, but what you're actually doing is you're hurting your dog. Stop overfeeding your dog. It's such an epidemic, okay? Please. I don't make a lot of public videos very often. I'm making this one because it's such a simple thing. Your dog's overweight. Stop overfeeding your dog. Period. That's why you're searching for a leg brace. Your dog is limping because it's overweight. Please, people, give this video a thumbs up. Let's get other people to start feeding a dog the proper amount of calories, and let's stop this epidemic of overweight dogs that have hip, leg, knee, Hocks, stifle joint problems. Please, people, I'm tired of seeing dogs limping around, and 99% of the time they're overweight. Thank you, and I guess subscribe.